My name is Sean Fidel. I'm the president and CEO of Nathan Littauer Hospital and Nursing Home. We're located in upstate New York. It is on the southern end of the Adirondack State Park. So we're the only hospital in Fulton County. We have 74 acute care beds with an 84-bed attached skilled nursing facility. And the core of what we do is we have 12 outpatient locations over a pretty wide geographic spread. We are the only hospital for hours, when it comes to that southern end of the park. The demographic that we serve is a rural population. Um, Primarily government payer, Medicare, Medicaid is the mix that we have in place. We are one of the only OBGYN providers for deliveries in the region. Otherwise, individuals would have to travel hours to get to the next place to deliver a baby. So we feel that we're an integral part of our community. We're one of the biggest employers in the region, as well as one of the biggest economic drivers in the region as well. One of the things that is true not just for Nathan Littauer, but for all rural organizations across the country is the access to staff. Recruitment and retention is very, very hard because you are dealing with a smaller mass of people. And it's a smaller talent pool that you're trying to draw from, or you're trying to bring people from the outside in. So you have to create an environment um, that is going to promote that recruitment and retention. Very big challenge, very different than what you would run into at a larger center or a more urban center. Uh, the other huge challenge that we have as a rural healthcare organization are things that people may take for granted. Transportation is a huge issue of being able to get patients who need care to your facilities, and if they need care beyond your facility, if their level of care is such that we need to get them out of our rural area to a more urban area, and then all the social determinants associated with that, uh, socioeconomic issues, food issues. The impact of closures of rural healthcare is, you could put it at a very high level as just access to care. One of the things that COVID-19 did for us is as devastating as it has been for this country. It shone a bright light on the importance of local healthcare, especially hospitals. When the system was on the verge of collapse because of the influx of patients, because of the unknowns that were wrapped around it, because of the acuity of the patients when we look back to 2020, 2021, the organizations that stepped up and filled the gap were hospitals, and especially rural hospitals. As a matter of fact, during that time, I was the CEO of a rural hospital in central New York, and it was a critical access organization, and we experienced one of the first outbreaks in upstate New York. Not, it was going on downstate in the city, but we experienced one of the first outbreaks in upstate New York. And as a critical access hospital, having patients in our ICU that we were caring for that we didn't know at the time, what it was and how to do it properly, but we were there, and we managed to save people's lives because we were there. If we weren't there, the likelihood of those patients being able to get the life-saving care that they needed in the time that they needed it would have been very slim. So I think this is one of the things that we have to take in consideration. Every one of those hospitals that close is providing for a community that has needs. And when that hospital closes, all the support around them, primary care, diagnostics, so imaging or lab, all of that goes away. And as I said, the challenges around rural healthcare with transportation, there are people that cannot get to drive the hour or several hours away to get to that next hospital or next primary care location. So they go without. So I think you're going to see a cascading impact that when people do finally hit the system, there's no preventative care anymore. They have gone to a point where they're going to impact the healthcare system at a higher level of acuity, and it's going to drive overall cost because we're no longer in a prevention mode because the supports around those rural communities has collapsed when it comes to their healthcare. So that is what I think we can't lose sight of the long game in this. It is an enormous challenge. Workforce is the shortages, not just with Nathan Tower, but across healthcare is well documented. We are now trying to provide the same or greater levels of care with less staff, not only clinical staff, but also our support staff when it comes to dietary and environmental service engineering. So it for us as an organization, it's a huge impact. It's a 20% increase for us over last year. Our carrying costs, not just for our staff, but also for our supplies. The recession hit us as well. So the cost of doing business, the business of healthcare, has increased. This is again an enormous challenge for us because when we look at our budget, one of the big drivers for any hospital is its people. We are down 50 FTEs from last year at this time, but that 50 FTE, we have a higher wage carrying cost than if we had those 50 FTEs in place. That is due to travelers. That is due to the short-term staffing that we have to put into place, as well as bonuses and sign-ons and everything that we've had to do to secure our workforce in a rural setting. Nathan Tower is a Medicare dependent hospital. That is a status that we have enjoyed for a number of years. It has added significant support to our bottom line. It's about $2 million of support a year for Nathan Tower. We utilize this enhanced program to help support our operations in the rural setting. If we were to lose that $2 million of funding and support around the Medicare dependent status, we would have to start limiting services, start limiting programs. We'd have to start making some very hard choices of pulling back services that we offer to our community and to our stakeholders in the region. Because we have to find some way to cover that loss. So this is really important to us, and I think not just to us, but I think when you start talking about low volume adjustments and the challenges that rural organizations face, when they are heavily government payer, like Medicare dependent, or the volume coming in is not the same as what you would see in our more urban setting, but they are still a critical organization in the area for the health and well-being of the community. Those need to be taken into consideration by our legislators. You have to act. When COVID-19 hit, we acted. We did not sit on our hands. We did not wait. We jumped into the fray. We ran to the tip of the spear, and we were the first line of defense for our communities over these last 2.5 years. And COVID's not gone. It's still here. We're still treating patients every day that are in our ICU or they're showing up to our emergency room. So that isn't gone. And there will be another infectious disease process that, like monkeypox, but it's not as quite as acute. But there will be things that we as hospitals have to take care of and support. And we do so without hesitation. We have amazing staff, amazing support structure, but we act, we get it done, we move forward. We need our legislators to do the same for us.